Hello everyone. Today we are going to start with chapter number 1, Introduction to Health Informatics. So by the end of this chapter, you should be able to describe the evolution of health informatics. Obviously, you know very well that 50, 60 years ago we started to have the first computers, and that new technology allowed us to look into ways to manage data that we already had, but that was in writing, and they were maybe on papers or some type of tapes, magnetic tapes. However, with the new technology for the computers, we started to look into how we could really manage the big volume of data. And before even going further, I would like to let you know that when you look into your desktop on Windows, or again on your Mac, for example, laptop, you can see many types of, I would say, numbers, documents. This is what we call data. So this is just a given value or a given I would say a number, or maybe a piece of information, maybe a picture. These are all data that we call. And now imagine that you are having that data all over your desktop and there is no order at all. In this case, you need to create folders, and by creating folders and classifying the data, we are going to achieve another step in health informatics, which is creating the information. What it means is that we are using the tools in health informatics, and we are going to use the data related to health, and then by putting or classified data into folders, we are now creating information or healthcare information. Now you may say, okay, what is the use of classifying the data? The use is that by allowing specific people at specific positions in institutions or corporations, we will be able to give them the classified data, so information, so that they will get the knowledge, a knowledge that's going to allow them to make proper and correct decisions, just to maintain the activities of that institution, of course their department, and obviously using more technologies, sometimes the same technology but having different designs that we can use, like databases where we use the same technology. However, the design of databases that we use in different healthcare systems are different. And now you understand from data what we are going to do in order to run our business and our institution. So this is why we talk about health informatics. So of course, for this course, we are going to get much more involved into the structure of the systems. We're going to look into many terms that are new to many of us. Again, we need to understand the terms so that when we are reading books, when we are reading reports, when we are looking into proposals, when we are dealing with different consultants and different firms that are going to install and maintain and even train our personnel on different healthcare systems, we will be able to understand, but of course going further to be able to decide, and of course again going further than that to be able to again innovate new solutions for managing and for using the healthcare data. So then for point number 2, you will be able to list health informatics system. Here we already gave you an assignment, And it's not just the assignment. You will need to look into different existing systems. As I told you, the technology is the same. Obviously, we can always increase the computing power of our tools, of our computers, or dealing with their RAM, which is the random access memory, or with the hard drives. We can make them, in disks, or we can have them in a solid state. These are all different types of technologies that we use in order to increase the power of computing. However, how we use that power of computing is different. We can talk about the tools, we can talk about the machines. However, we need to also know about how we are going to use those machines. So by looking into the different health informatics system, so you are going to learn more about the design. So how we are using again different health informatics systems, and what are those health informatics systems around us. And don't forget that those systems were not there 20 years ago or 30 years ago. With the technology, with the capacity of the computing that was increasing more and more, we were able to ask more from these tools. And of course, by having much more computing capacity and speed, we were able to, of course, expand the use. And I can tell you that in the next, I don't know, maybe 5 to 10 years, we are going to get, so many information regarding people, regarding their health status. Even we are going to even use artificial intelligence, so that we will be able to use our systems to set alerts based on specific scripts that we give to the system. So the system will be able to look into the trends, for example, the trend of, again, our heart rate or our blood pressure. And just by having some type of computers that we are going to have connected to our body, we will be able to monitor again our health status. So this is where we are going. It's very, very interesting how those systems they evolve. Then for point number 3, we'll be able to explain the differences among many health informatics systems. So here you will have to discover those. You will need to again use the assignment that I gave you in order to look into different sources. You can look into the library, you can look into, again, internet, and you're going to try to find at least two systems, and you're going to be able to compare those systems. If not, you can just choose one, of course, a system, and you can explain that, or you can, of course, think about innovation, and you will be looking into what may be there's systems in the next few years. So this is just for pushing you or giving you a type of assignment in order to learn more on your own side. And then for point number 4, you will be able to explain the intersection between health informatics and health management. Indeed, health informatics is mainly the use of computers. However, health management goes beyond just the use of computers. We are dealing with a population, and we are dealing with different people, genetic differences as well, and again, the way that they are living, the food that they are eating, different types of medications that they are using, they're all going to be factors that are going to affect these people. Now, we have not only the physical health, but the mental health as well. So we are going, of course, for mental health issues. We may, for example, look into different tests, of course, that must be validated as well. But we are going to put all of the data, again, into a repository that will be accessed by people, I would say automated, mainly systems managed by people like us, who will be able to classify the data, and then to decide how those data is going to be classified, and then we are going to give access to these classifications or to this information in order to allow healthcare providers or the government officials, or I would say our government services, and of course our patients and people, in order to get more knowledge regarding their health status. So as you see, health management is different from health informatics. However, they are having some intersections in between. Now for number 5, you will be able to explain the intersection between health informatics and health policy. Why? That's because when we talk about policy, we are talking about rules, we talk about regulations and laws. So we see that more we are going to have, again, a use of health informatics systems, we will see that now we are able to manage a bigger data, bigger volume of data. And by having that type of advantage, we are now going to expand our vision and our knowledge regarding individuals. Now, the first thing that comes to your mind is privacy of people. So do we have privacy in our mind? Do we have any law for the protection of the privacy of our patients? This is just one example that you can explore, and of course we will be able also to talk about these different policies in the live class. Then point number 6 is to appreciate the technological context within which health informatics evolve. In order to be able to appreciate that type of evolution, you will need to look into the history of health informatics. And this is why, while you are going to read this chapter, and while you are going to look into maybe more resources on internet and of course in the library, you will be able to look into the very first systems, very simple, but still very functional. And you can see how the technology, the evolution of the technology, and of course the evolution of the design and the speed of computing helped us to manage more and more data and to be able to look into more and more different factors that are going to be health determinants, for example. Okay, then of course point number 7 is that you will be able to describe the competencies needed by a health informatics professional. So now talking about the informatics domains, again you may find different types of classifications, but here in this book we are looking into this type of table where we look into the bioinformatics. So we look into the cell level, we look into imaging informatics, we can look into clinical informatics, and we can know about public health informatics. Now please go back and remember what I told you at the beginning of my lecture. We do have data, we classify the data, we put the data into specific folders so that the data becomes information. And by giving access to specific people to those types of information, we create knowledge. And the knowledge is going to be used for making policies, for creating new systems, for educating more individuals, for doing trends on the health status of different population, on looking into even designing new drugs. Again, it can go on and on. So it's extremely important that we have a type of repository of data that we can, from which we can make different types of information by classifying them in different ways, and then to use the information to learn it and to get the knowledge. So here, when we talk about bioinformatics and we just see cell levels, these are all data. So now when we have data, we can classify them based on the data that we have in microbiology, based on the biochemistry, so chemistry of life. So based on the physiology or how organs they work, and then based on the genetics. So we may now imagine that we may have a person and we are going to be able to get some information regarding the bioinformatics of the person. Of course, I'm not referring to any policy here, to any privacy act here. I'm just talking about the health informatics domains, of course. So to what extent what I'm telling you is feasible or acceptable by the culture, by the ethics, this is another topic of discussion. Here we're just talking about what can be achieved by using the tools. Now for the imaging information here, of course, we can look into the organ level, looking into tissues and organs. So the type of data that we may get is different, and you understand that very well. Now for the clinical informatics, we are looking into clinics, so dealing with the entire body of a person, of a human here. So here we are looking into the data that we can obtain and we can keep and then classify and then use for individual patients. And of course, as you see, we started with a micro and now we are reaching the macro level. So at the level of micro, we have been talking about the cell level, about the organ level, and then personal level. But now we can expand the use of health informatics at the population level or the society. So this slide is again telling you that again the tools that we have in health informatics can be used for basic research, for fundamental research, for clinical research, and of course for public health. And this is why in several, in all of the universities, in different centers for research, in the many ministries of health, it may be provincial or again federal in Canada, for example, we do have several tools and they're all using the informatics. Now coming back and talking about the health informatics, this is when we are going to use data related to the health of individuals, and we are going to be able to look at the trends at the level of an individual or at the level of a population. So that if this is, for example, regarding the medical information, nursing, dental, etc. information for an individual, this is going to allow the healthcare provider who has access to his or her patient's data to look into the medical history, to look into predisposition of the patient in order maybe to see if there is any predisposition for having a disease in the next 5-10 years so that we can prevent it. Or we can just let the patient know that the patient has to be careful for some exercises, for some type of food, for some type of drug, or they have to be monitored much more for their heart, for example, just to prevent harm later. So this is just one way of looking into health informatics. And of course, as you see, it's not just at the level of the individual, this is also at the level of the local populations and different communities. And of course, we can expand it to a global population health informatics. So now we can start by looking into, again, micro. We can look into one patient. A patient may be just having a blood pressure monitor and he or she is monitoring the blood pressure every day. This is just one way. This is at the level of the micro. Now it can go through a medical office where we are having several patients and the medical doctor is looking into the medical history and the health data of several patients in order to be able to serve them much better. We can now go at the level of the hospitals. We can go through the level of, for example, again, I would say provinces, now national, And then we can also reach the level of international population, where you do have some organizations like World Health Organization, or WHO, that is also having so many different tools in order to look into the trends in the health informatics related to the global population. So now we understand that health informatics is a multidisciplinary field. So not only we are dealing with people, we are dealing with technology, and we are dealing with information. And again, I would like to repeat by telling you that information is when we are getting the data and we classify the data. Now again, the classification may be from different angles, okay? So we are classifying the data, and we are going to use the data using the technology in order to serve the population. So now here we can talk about the knowledge. So this is health and biomedical knowledge that we can get from again the health informatics field. It's also related to the information and computing science as well. And this is why, as I told you, for this course we are mainly focusing on the computing science, and we are going to look into many terms and of course many healthcare systems that you will discover on your own, or we are going to cover because we have to explain that in and out in the next lectures. Now for the skills that we need in health informatics, one of them is data analysis. It means that it's not just entering the data, which is also important, and we need to have some knowledge in biology or in chemistry, or I don't know, in any other field related to health, so that we can understand the data. If there is any error, we will be able to clarify the data with the sites from where the data has been generated or observed, or I would say taken. And then we are going to be able to use our systems in order to do the analysis, to look into the trends. Is there any trend here? Are there other factors that may affect this trend? So let's look into now the effect of these factors, several factors: age, gender, level of instruction, the way that people are doing exercise, again, if they have a medical history. And then we are going to compare, again, or I would say the effect of these factors on a fact that we are seeing, on a disease or a trend that we are seeing in the health status of a patient. Then we can talk about the skills like data management, where this is not necessarily data analysis. Data management is managing the data. Now it may be on the servers, on different repositories. When we talk about servers or repositories, they may be local, they may be online, so we can talk about clouds as well, cloud computing. All of these different tools, they must have a design, and we always go through a design qualification. So we always question if the design that we are going to use for a system is going to be the best fit or best match for the use of that data. Then we can look into, again, different types of databases, for example. We can look into different types of computers, different types of systems. As you know, we don't have only Windows or Apple or Macintosh. We do have other systems, and the way that those systems or computer systems are behaving is that they use the machine and they use different accessories connected to the machine in order to, I would say, to do the I cannot say transaction, but to do the operations that are necessary for some type of again, calculations, for example, or looking into the trends or looking into the statistics. Then we can talk about the system analysis and design. I already talked about the design. But when we are also having a system that is well designed, this is one thing. Now we have to install a system. where we install it, in which system we install it, on which server we install it, who is going to have access, what are the ways that we are going to maintain the system, how we are going to train people, how we are going to look into the compliance with the policies, what type of guarantees we are going to install or to have, so that not everyone is going to have access to everyone else's data. So these are all different types of design that we have to keep in mind when we are again designing and installing those healthcare systems. And of course, I don't talk about training for now or maintenance, but this is for now, for this slide, this is sufficient for now. And of course, we need to do research for looking into new ways to use the systems that we have, or to do research in order to improve the systems that we have. Maybe creating new computer systems. You never know what will happen in 5 years. Maybe we are going to have another system that is going to be much faster, much more safer, and much better, I would say, overall, than any existing system that we have now. We don't know, but usually, we are going to see that. We are going to see lots of evolution, especially in technology. This goes fast, and it goes always in a positive way. I'm talking about the about the technology itself, not the use of the technology. I'm not talking about the policies for the privacy of, again, information of people, for example. I'm just talking about the tools that we have. And of course, now you understand what is health informatics. Perfect. So now here, for example, we can talk about EMRS here. You will need to learn these abbreviations as well. I know that sometimes we may say it's not worth, but this is worth, because when you are going to work in a hospital, or again in a ministry, or even in a medical office, or any place where you're dealing with health informatics, we always use different abbreviations that are the same. So you have to be able to understand what we are talking about, to be able to communicate with the colleagues, with consultants, with policymakers when you are learning from a book or from some articles. So one of them is electronic medical records, EMR. One of them is clinical decision support systems. As you see, just based on the name, they are having different functionalities. You can also look into picture archiving, because of the nature of the data, which is not a text or a number. This is mainly a text, so it takes usually a bigger volume. The size is bigger for the files, so you see that the technology that we are using may be different. We can, for example, we need also some searching capacities. We do have that technology to search not only in the text, but also to search within images, which is very interesting. Then we can have other systems like computerized provider ordering system, telemedicine or telehealth, consumer informatics, public health informatics, and of course we have to talk about their role in the big data, managing the big data, maintaining the big data, and using the big data. Perfect. So my friends, please kindly now at this time review the PowerPoint presentation, and of course if you have the book, please read the book chapter. This is for chapter number 1. If you have any question, you can always look into searching for resources in the library, in the resources. I'm also going to add some YouTube movies on the course website. And obviously, we'll be able also to meet each other in class, in the online class as well, in order to have live discussions, so that we'll be able to respond to your questions. Thank you so much, and see you for the next lecture.